In this video, I'll explain what knee osteoarthritis is and why it might be relevant to you. Osteoarthritis is a degenerative disease of the joint, and in order to explain what it is, I'll first explain the structures that make up your knee. So there are two large bones that connect at your knee, and there's a structure called the cartilage in between these bones, and that creates a cushion for the bone. And in OA, what happens is that the cartilage gets worn out, which means that your bones have lost some of that cushioning. In more severe cases, all of the cartilage may be worn out, and this can cause bone spurs to grow, which can restrict the movement in your knee. OA can also present in other body parts as well, such as the hips, the spine, and the hands, but for today we'll focus just on the knee. So how does knee osteoarthritis occur? Well, there are two main ways where it can happen. Sometimes it occurs without any cause and just through general aging, but sometimes it can occur due to a traumatic incident. So for example, if you've previously injured your knee, that can put you at a higher risk factor of getting knee osteoarthritis. So what are some risk factors to developing knee osteoarthritis? The most common risk factor is obesity, and this is because of the added pressure that's put on the knee joint. Secondly, immobilizing your knee or having a sedentary lifestyle can also put you at a higher risk of developing knee osteoarthritis. And this happens because of the restriction of the fluid movement within your knee joint. And lastly, having a family history can also put you at a higher risk. So how do you know if you have knee osteoarthritis? Well, here are some common symptoms that you may notice. The first one is having knee pain. This usually progresses slowly and generally gets more intense with activity. You may also see some visual swelling around your knees, and it may feel stiff. Stiffness usually occurs in the morning after you've been quite still from the night. And you may also hear some cracking or popping sounds from your knee as you move it. And lastly, you may see some loss of range of movement within your knee. So who does this affect? Nearly 6% of all adults are affected by osteoarthritis, and this mainly affects people over the age of 45. This number then rises to 40% at 70 years of age, and your knee joint is the most commonly affected joint in osteoarthritis. And lastly, women are also more susceptible to developing knee osteoarthritis. How can this be managed? In the early stages, the best way to manage knee osteoarthritis is through exercise. And unfortunately, there's no cure to osteoarthritis, so our main goal is to prevent it from getting worse. In the rest of this video, we will demonstrate some exercises that you can perform at home. These exercises don't have to be performed only if you have knee osteoarthritis. They can be great as preventative care and will also help strengthen the muscles around your knees. You can pause this video now and grab a towel, a chair, and a mat so you can perform these exercises. For the first exercise, grab a towel and place it under your heel like so. And just work on bringing your heel closer to your bottom and sliding it on the ground. Remember to keep your back straight while doing this exercise. And you can repeat this exercise 10 times. This is a simple knee mobility exercise that will get your knees ready for the next strengthening exercises. After you've completed 10 of these, take a rest for 10 seconds. So now let's repeat this set of exercise one more time. So we're going to do this knee mobility 10 times. Once you've completed 10 of these, take a short break. For the next exercise, take the towel and roll it up like so and place it under your knee. Place both your palms on the ground for extra support. And now just work on extending that knee and pointing your toes up to the ceiling. And this will work and strengthen your quadricep muscles, which is at the front of your thighs. And repeat this exercise 10 times as well. Once you've completed 10 repetitions, take a break for a minute. Now we're going to repeat the same exercise again, making sure to complete it 10 times. Once you've completed it 10 times, take a break for a minute. For the next exercise, lay on your back and bend your knees. And place your palms on the ground for extra support. Now just work on squeezing the muscles in your bottom to push yourself up and make a bridge. And you can repeat this exercise 10 times as well, making sure to slowly lower yourself down. This exercise targets and strengthens your glute muscles, and this is the muscles on your bottom. Once you've completed 10 of these, take a 1-minute rest. And let's repeat this set of exercise one more time. Once you've completed 10 of these, take a rest for a minute. For this next exercise, grab a chair that you can hold on to for support. Place your bad leg in the front, hold on to the chair for support, and just slightly bend through the knees. Be cautious with the leg in the front and make sure that your knee isn't going over your toe. And repeat this exercise 10 times as well. Make sure you're keeping your back straight and looking forward. Try not to slouch. And once you've completed 10 of these, take a rest for a minute. And once you're ready, repeat this exercise one more time. Once you've completed 10 of these, take a well-deserved break for a minute. For the next exercise, we're going to perform a mini squat. So grab your chair and stand about shoulder width apart. Hold on to your chair for support and slightly bend at the knees as if you're going to sit in a chair. Dip your knees to about 45 degrees or to a point where you feel comfortable. Once you've completed 10 of these, take a 1-minute break. And let's repeat this set one more time for 10 exercises. Once you've completed 10 of these, take a break. For the next exercise, grab your chair and stand about shoulder width apart again. Now just get onto your tippy toes and hold it for a few seconds and then slowly go back down. And as it says in the name, this exercise targets your calf muscles. And repeat this exercise 10 times as well. Once you've completed 10 of these, take a rest. And now we're going to perform this set 10 more times. Now that we've completed all the exercises, we're going to go into some stretches. The first exercise is a calf stretch. Make sure you place your bad knee at the back and bend forward through your front knee, keeping your back knee straight. Look forward, hold onto your chair for support, and you should feel a stretch on your calf. This next stretch is for your quadriceps, so you can stay in that same position that you were previously, placing your bad knee at the back, and this time hold on to your waist and just slightly bend your back backwards. You should feel a stretch on the front of your thigh. We hope you enjoyed these exercises and thank you for watching.